This video is for informational purposes only. The information in this video is not a substitute for medical advice or diagnosis. Postural drainage is accomplished by positioning the patient so that the angle of the lung segment to be drained allows gravity to loosen the thick, sticky mucus in the lungs. Mucus can then be more easily removed with a huff or cough. Keep in mind that modified positions may need to be used when there is a precaution or contraindication to the ideal position. There are a variety of beds within a hospital that employ manual or electric devices to position the patient. The use of pillows or bedrolls can help to support body parts or relieve pressure areas while in the different positions. In the home setting, pillows, a slant board, a foam wedge, sofa cushions, or a beanbag chair can also aid in positioning.
After determining the lobe of the lung to be treated, position the patient in the appropriate position. If postural drainage is used exclusively, each position should be maintained for 5 to 10 minutes if tolerated, or longer when focusing on a specific lobe. If postural drainage is used in conjunction with another technique, the time in each position may be decreased. Note that a patient who requires close monitoring should not be left unattended in a Trendelenburg position. Encourage the patient to take deep breaths and cough after each position if possible, and again after the treatment is completed. Advantages of postural drainage are as follows. It can be coordinated with other patient activities in the hospital or at home. It is relatively easy to learn, and it is cost-effective. There are also a few disadvantages to using postural drainage. For many patients, optimal postural drainage positions will be contraindicated for a variety of reasons. Adherence to postural drainage may be reduced due to the length of treatment and the cost of the caregiver's time.
The patient is positioned in supine in the Fowler's position, where the head of the bed is raised to approximately 45 degrees. A pillow should be placed underneath the head and knees. The patient is positioned in supine in the semi-Fowler's position, where the head of the bed is raised to approximately 30 degrees. Pillows should be placed underneath the patient's head and knees. The patient is positioned in supine on a flat table or bed. Pillows should be placed underneath the head and knees. Hips should be in external rotation. The patient is positioned seated in a chair. The patient then leans forward over a folded pillow.
The patient is positioned in semi-prone with the right side higher than the left. The patient should be lying on a flat table or bed. Pillows should be placed underneath the head and feet. The patient is positioned in semi-supine with their left side higher than the right. The bed is in the Trendelenburg position. Pillows should be placed underneath the head, in between the knees, and behind the patient's back. The patient is positioned in prone on a flat table or bed. A pillow should be placed underneath the patient's hips and feet, but no pillow should be placed underneath the head. The patient is positioned in semi-supine with their right side higher than the left. The bed is in the Trendelenburg position. Pillows should be placed underneath the head, in between the knees, and behind the patient's back.
The patient is positioned supine in the Trendelenburg position. Pillows should be placed underneath the head and knees. The patient is side-lying on their left side in a Trendelenburg position with shoulders and elbows flexed to 90 degrees. Pillows should be placed underneath the patient's head and between the knees. The patient lies prone in the Trendelenburg position. Pillows should be placed underneath the hips and feet. There should be no pillow underneath the head. The patient is side-lying on their right side in the Trendelenburg position. Pillows should be placed underneath the head and between the knees.